Good afternoon, everybody. I'm really excited to be among all different disciplines other than health and physicians here. I'm going to talk about child maltreatment in general in the Arab region and the challenges that we might face in the global violence reduction. And I will touch a little bit on sexual abuse, and the reason for that because there wasn't really much of data that we could find in sexual abuse. When we talk about Arab region, we mean the state of the Arab League, which is about 22 countries. The majority of these 22 countries are in the MENA region, or the Middle East and North Africa region. Some of the Arab states are in Africa region. There are some states are MENA region, but they are not Arab state, like Iran. Iran is up here, and it is considered in the MENA region. So a lot of time these two terms, Arab League and MENA region, are used interchangeably, but it really means about these 22 Arab countries that they are in the MENA region. I put this slide just to show that this region is a very hot area with armed conflict. We had so many countries in the last 5-6 years going with the revolutions, and they call it Arab Spring, but I don't know what we would call it. It's maybe autumn, not spring anymore. And it's like a dominoes. It's just like you'll have an armed conflict in one country, and then another country will have it. I'm mentioning that because an armed conflict in one country affects really the other countries negatively. For instance, the armed conflict currently in Syria affecting Jordan and Lebanon a lot. When there was an armed conflict in Yemen, has really affected Saudi Arabia. So it's a hot area, and it's challenging in terms of child maltreatment, because we know that trafficking of children, street children, child marriage, maltreatment, all these is increasing now with this conflict. Among these Arab countries, I mean, a lot of them are, what common about it is the Arabic language. All these 22 countries speaks Arabic, written and writing, although different dialect, and also religion. So David today talks about, having countries not really based on region, but based on culture. The culture of this area, the Gulf area and the Middle East, is very similar, and it's a little bit different than the culture of the areas in the North Africa or the countries considered Arab countries like Somalia and Ethiopia, but their culture is completely different. So although they are among the Arab state. I thought I will start my slide by diagnosing what is the problem. Just getting to know before we get really into therapy or treatment or solution. Let's talk what is really the major problems that all Arab countries, or the majority of them, they are facing. During when I was preparing for this, I was trying really to get some decent data about child maltreatment in the Arab region, and data collection is really a major problem. It's really maybe the first disease in the body of the child maltreatment in these countries. There is lack of government reports, and even if we find government reports is given to UN for CRC or for any other things, it's really lacking numbers about the magnitude of the problems. The research are scarce, small case reports or small studies, no prevalence or incidence survey, and importantly, there is lack of data integration or data linkage. So you'll find data from the health sector, and then you'll find data from the police, but there's no linkage of data. The other major problems is variation of the economic status between countries, and as long as we're having these problems, we're going to have a major problem with the trafficking and street children. And the best example here is what's between the variation between Yemen and Saudi Arabia. Saudi Arabia being a rich country and Yemen is very poor, so we're having a lot of trafficking, and then Saudi Arabia is having major problems with the street children, who are the majority are Yemeni. The same thing happens between Kuwait and Iraq and other countries. So these variations in the economic status is really creating also a major challenge between these countries. The armed conflict, which I already mentioned some about it, is just like the problems with the refugee now. I mean, there is 1/3 of the populations of the Syrian are now refugee, and Lebanon alone having about 1 million refugee, and the street children are really increasing in Lebanon, and 80% of street children in Lebanon are Syrian. So the armed conflict is a challenge, and in the area. Cultural issues and social norms. What we do consider ourselves in this room as abuse or harmful practices, it is really difficult to convince everybody there that it is a social norm, and it's viewed as a protection. And also the sensitivity of sexual abuse. Still, sexual abuse is really a shame for the victim, whether it's a boy or girl, especially girls, because of the hollow around virginity issue. So sexual abuse is still a taboo, and bring shames to the family. So you will see if any professional wanted to be involved in a study like the mix or DHS, then the questions about sexual abuse is removed, because it is like nobody dare to go and ask the family about this. Variation of the problems in various countries, and also this goes really to the variation of the economic status. Some countries are talking now about cyberbullying, like Qatar, and then people are really suffering from really basic needs in other countries. This thing is also an important problems is all Arab countries have signed and ratified CRC. And more than 50% of the Arab countries, they do have a national law on child maltreatment and child protection. Yet the implementation of the law is very poor. So I thought this really, to start, that 8 major problems that it is, you can see it on the at different levels from all the countries in the Arab regions. Saying that, I'm not really here in a position to give solutions for all these problems. I know it is difficult, but I thought, like, knowing, what is the diagnosis is you're solving half of the, you're getting half of the way there. But to look into the issue globally and from strategic point of view, I looked into this model. This is a 10-dimension model that was prepared by a group of experts with the WHO on prevention readiness. The team was led by Christopher Micton. And we did apply this model in Saudi Arabia to see how prevalent, how ready is the country to implement evidence-based child protection services. So I thought it is a 10-dimension. It started from the attitude and goes around. And I will go through this dimension to try to apply it to the Arab region and see where is the problems and how we can really tackle this problem. Dimension 1 is the attitude and the social norms. And I said from my first diagnosis list is that this is a major problem. And the best example maybe is female genital mutilation and cutting. You can see that a lot of Arab countries like Egypt and Sudan are among the highest prevalence of the problems, although it is more prevalent in African country. And also some other countries are in smaller percentage. But the important of these, it's very difficult to change the social norm. And when you ask young women and girls about should the practice continue, about 40 to 50, 60%, they said that the practice should continue, although they are the victim of this practice, and didn't change between the older women and young women. Even if you look into statistics, that the change is really very little between what the women over 50 think and young girls think. They all think the same, that this practice is a protection for women and should continue. So the question is, how could we really change the mindset of these victims, that they still believe that this practice should continue? The other point about attitude is that there is a law. Most of these Arab countries that practice FGM, they do have a law that prohibits this practice, yet it's still done. And the best example is, I mean, all of them within the, in 2000 and 2005 and 2008, they have a law that prohibits this practice, but still practice sometimes is in the hands of traditional healers. So attitude is a major problem. The same thing here when we talked about wife beating and can be justified for any reasons. And you can see our region, Middle East and North Africa, make it almost over 50% of young girls, adolescent girls, think that they justify the wife beating if for any reasons, for like if she left the house without the permission of her husband. And this is one of the main reasons that a lot of people in this region, in that region, they justify wife beating if she left the house without getting a permission from her husband or if she did not cook. So still the attitude, I think, is a major problem. And then how to solve these problems? I think we should really emphasize on the positive attitude. I mean, we should really use that area is a lot of area they do believe a lot in religion, and this, so we should really look into the positive things in religion and the positive things in the culture and try to boost it up to overcome other negative attitude. The second dimension talks about knowledge, and I think I found that knowledge is really poor, not only for professionals, but for the decision makers. And we are facing these problems in Saudi Arabia. So you will see the professionals are, their knowledge is fair, it's not really bad, but when we come to policymaker and try to convince policymaker about any programs, their knowledge is really very poor and they don't want to improve that knowledge. So they don't know much about the long-term consequences and what program works and what doesn't work, and it's very difficult to convince the decision maker if they are not really don't want to improve their knowledge or they don't want to listen to us. Dimension 3 is data, and I'm not going to go through this because the data was really is not helpful at all, because it all depends on small studies and the percentage was really not right. But when you go into countries that are involved in mixed studies or DHS, you will find that 2 of the Arab countries make it on the top of the list in terms of severe physical punishment. So we know that the problems is common there, even if we are lacking the data. I'm going to mention something about the data that we collect in Saudi Arabia, and I mentioned the adverse childhood experience study. We used the international questionnaire also prepared by WHO here, and we did it in 2012 in all the region in Saudi Arabia, and we had over 10,000 adults participated in this study, talking about their adverse childhood experiences and linking it to physical diseases. And I'm not really going to present because the data is really a lot, and I'm just going to show that with a study like that, that looks at prevalence of exposures in adults, we know that the rate of abuse is really pretty high. This study looks into 8 categories, like household dysfunction and abuse, and this is just the one category, which is the abuse that looks about psychological, physical, and neglect, and sexual abuse 21. And even we found in this study that sexual abuse is more common, men reported it more. So whether it's really happening more and more in boys than girls, because girls are more protected and are in the house, or because men are able to talk about it more than women, we really don't know. Also, we looked into the number of adverse childhood experiences they're having, and about only 20% of the populations, they have no ACE, and about 30% they have more than 4 and more ACEs. So there's the exposure of adverse childhood experience is pretty high. And when we link it to disease, and this is a slide that I got from John Fluke, who's helping me analyzing some of these data, it shows that even with 4 and more ACEs, the mean percentage of diabetes increased, which is diabetes is #1 chronic disease in Saudi Arabia. The prevalence is about 30% in different studies that is done. So 1 in every 3 adults is diabetic, and it is more prevalent among women compared to men. Another study we did in Saudi Arabia that also shows the incidence of the problems is ICAST, or the International the ISPCAN Child Abuse and Neglect Screening Tool that we did it in children. And in this study, we did it in the 5 main regions of Saudi Arabia: the central, north, south, east, and west, which is really holding about 80% of the population. We did it also on boys and girls in school, and we were able to get the approval to do it among high school only, children between the age of 15 to 18, because we couldn't really get the approval to do it in younger children from the government. And I think a lot of countries are facing the same problems. But even with this study, also we had tremendous data that comes from it that shows that there is a major problems with abuse, and we were able to see children reported 80% reported psychological abuse, physical abuse 60%, neglect, and sexual abuse is about 13%. And also in these studies, boys were reported more sexual abuse than girls. Also, we were looking into witnessing domestic violence, and about 1/4 of the students says that they witnessed physical violence of other member in the household. So we were able to look into all these data, and now we can, although we cannot really compare between the two, but at least we have some informations about this and about adverse childhood experiences, adults reporting what's happening in their childhood, and about children. And it's both of them shows that the rate of child maltreatment, whether it is sexual or physical or neglect or psychological, is pretty high in this. And I'm expecting that these numbers to be reflected also in other Arab countries. I don't think that the other Arab countries, they will have a lower rate, especially the one with the armed conflict. Dimension 4 is about programs and what is available and is it been evaluated. There is also very, very limited programs, prevention program, whether it's a primary or secondary prevention. And a lot of this program, which is existing sometimes, is not evaluated. And the best, and I was surprised to see this from the report from UNICEF that mentions that the early enrichment project, AGEF, has been done in different Arab countries, Jordan, Lebanon, Saudi Arabia. But I know in Saudi Arabia it's done only in Riyadh. We haven't really been able to go to other region, and it is not evaluated yet. So yes, there is some programs that is making a difference, that is been implemented in some of the Arab countries, but they are still not really widespread and not scaled to all the populations. Yeah. Okay. I think the legislation, I did mention that the major problems is not really the legislation, is the implementation of this, and how what is the recommendation we have in this. It is really tough, because we just in Saudi Arabia passed the law last August 2013. I worked on this law for 7 years to get the law passed on domestic violence and child abuse. It is passed, and now it has been a year, and the implementation is less than 10%. Police are refusing to implement the law, so it is a bit challenged to implement it. And the best example also of implementation of law is the child marriage. Almost all, other than Saudi Arabia, did not have this law yet. But most Arab countries, they have a law, they have age for marriage. All of them, especially they, like Yemen, Sudan, Egypt, they have an age for the girls is 18 to get married, over 18. Yet even with this law, still child marriage, there are problems in all countries. So you can see here, Middle East and North Africa is about 18% of the people are married before of women are married before the age of 18. And in Saudi Arabia, we found in our ACE study, 12% of women said that they've been married before the age of 18. So although there is a minimum legal age, people still practicing child marriage because of different reason. Political will can help. I think in Saudi Arabia helped us a lot, having a public figure who's really carrying the file of child maltreatment and domestic violence from the royal family. It helped really move a lot of things. The weak governance in other countries, like, I was surprised to see, like in Egypt, where during Mubarak law, there was a lot of law that is good for women and for children that is passed. The minute that this regime is collapsed and the Muslim Brotherhood came, and everything is gone. So, and now a lot of countries are going through conflicts, so there is a lot of weak governance that is not. And then it's not really in the national priority, child maltreatment. Now, for instance, Saudi Arabia, when I talk about child maltreatment, they said their priorities is terrorism and fighting terrorism. So child maltreatment is not really a national priorities. Collaboration between sectors, I think this is a major problems all over the globe and in every countries. We have a major problems with that. Surprisingly, in Saudi Arabia, when we did the readiness study, we found that, and Saudi Arabia considered one of the rich countries, at least in the region, we find that human and material resources is really very poor. We don't have enough people working in this field, yet they are not really well trained. And also the material resources, once you go beyond the urban areas or the big cities, when you go to remote areas, the resources is very poor. And this applies a lot to all Arab countries. And the weak NGOs, because of the freedom and the political situation there, NGOs have not been playing a major role in a lot of countries. So it is the government that really is in charge. So NGOs is not doing a lot. And this is my last slides. Is just like I looked into the 6 recommendations, simple recommendation or 6 strategies for action that is published recently by UNICEF. And if you look into the first 3, really supporting parents, working with children, and changing attitude. And I think these 3, this is what is really needed in Arab countries. We really need to work from the bottom up and working at the grassroots and helping the people, work with children, with families to change the attitude. These are the important thing. I think the other 3, whether services, law, and data collection, it is really important. And I think we should really continue on that. But I think the first 3 is implementing prevention program is really, and putting child maltreatment in the National Development Plan. And that's what is one of the things that I'm really working in Saudi Arabia, is trying to allocate specific funding for child maltreatment and putting it as an agenda in the national plan. We have a national plan every 5 years. So we're hoping that it will be coming as an agenda. Thank you. I'm sorry I didn't talk much about sexual abuse because there isn't much to. Thank you.